The broadcast is
Hello, everybody. Sorry about that. We had a little bit of technical difficulties, so I apologize for kicking you all off. So welcome to the Action for Healthy Kids webinar. Today, Dr. Jamie Shrieky, Dr. Yuka Asada, and Dr. Marlene Schwartz will be presenting. We'll be presenting on students to superintendents, key stakeholders, qualitative perspectives and experiences with local school wellness policies. So before we get started, just want to go over a couple of logistics. Once you're linked in, you'll see a control panel, usually on the right side of your screen there. You can use your phone or speakers to listen, but everyone will be muted, and that's to avoid any background noise. There's a dialog box at the bottom of your control panel, and you can type questions into the box as we're going along, and we'll try to get them answered later into the presentation. This webinar is being recorded. Links to the recording and the handouts will be sent to you 2 to 3 business days after the webinar. So before we get started, we'd like to get a sense of who's on the phone today. You'll see a poll pop up on your screen.
Jill, we can see the poll. It's already up. Can you see it?
No, I can't, but as long as everybody else can. So
That's
if you
okay.
can go ahead.
I'll read it out loud for everyone. It just says, tell us your primary role with school. So if everybody could go ahead and select one, you'll see school professional, student, researcher, parent, or other. We'll give everyone another 15 seconds to go ahead and put their role in. Cassie or Jill, whoever is controlling that, you can go ahead and close the poll. And then can you share the results? Perfect. So it looks like 59% of us are in the other category. There's 30% of us are school professionals, 3% identify as students, 7% researchers, and about 1% in that parent category. So thank you everybody for sharing. And Jill, you can close that poll and move on to your next slide.
Great. Thanks, Christina. So during today's presentation, we're going to hear from 3 presenters. We're going to hear from Dr. Jamie Shrieky, who is a professor in health policy and administration in the University of Illinois at Chicago School of Public Health, and she co-directs the Health Policy Center in UIC's Institute for Health Research and Policy. She is the principal investigator of the National Wellness Policy Study. We'll also be hearing from Dr. Yuka Asada, who is a postdoctoral fellow with UIC's Institute for Health Research and Policy. She has been co-leading the qualitative stakeholder studies for the National Wellness Policy Study. And lastly, Dr. Marlene Schwartz is professor of Human Development and Family Studies and the director of the Rudd Center for Food Policy and Obesity at the University of Connecticut. She is the co-principal investigator of the National Wellness Policy Study. Welcome, Jamie, Yuka, and Marlene. Jamie, please take yourself off mute and you can begin your presentation.
Great, thank you very much, Jillian. Can you hear me okay?
Yes.
Great. So as Jillian indicated, it's our pleasure to be here today. We are really looking forward to this. The National Wellness Policy Study has been going on for a number of years, pretty much since school year 2006 to 7 when the National congressional mandate for wellness policy started. Today's presentation focuses on some research that we've been doing over the past 3 years or so to really explore qualitatively, primarily, stakeholder perspectives related to school wellness, school food and nutrition, and related issues. And we'll also throw in a few little slides on some quantitative work we've been doing under the National Wellness Policy Study. For purposes of the stakeholder experiences and perspectives that we'll be presenting today, the stakeholders included food service directors, high school students, superintendents, and parents, specifically of middle school students from states across the country. So in this presentation, we'll be sharing their perspectives both collectively as well as individually, so you can hear sort of a broad range of perspectives related to school wellness, school food and nutrition, and related issues such as food marketing. Next slide, please. Julian, next slide, please. The funding for this study was provided by the U.S. Department of Agriculture, and our program officer, Holly Figueroa, unfortunately probably is not on the phone because USDA is affected by the government shutdown. Next slide. We're going to briefly tell you a little bit about the National Wellness Policy Study, briefly review our methodology, and present some of our key findings, and then end with discussion of implications and recommendations, as well as provide information on how to access our resources, including research briefs and reports and things like that. Next slide, please. Next slide. So I'm sure most of you on this call, if not all of you, I'm not quite sure who's in that large other group, but most of you are probably familiar with the National Wellness Policy requirement, which took effect effective school year 2006 to 7. Most recently, the U.S. Department of Agriculture issued a final rule which required revised wellness policies for the school year 2016 to 17 to include some specific provisions. The original rule required goals for nutrition education, physical activity, and overall school wellness, guidelines for the sale of foods and beverages outside of school meals, an assurance that all meals met the national federal meal standards, implementation evaluation provisions and requirements for stakeholder inclusion. The updated rule in 2016 to 17 includes some additional provisions which include policies on marketing that allow advertising of only those foods and beverages that met the USDA Smart Snack standards, which impose specific restrictions on nutrient, fat, sodium, and sugar content for foods and beverages sold and served in schools. The rule requires involvement of additional stakeholders in policy development, implementation, periodic review, and updating of the wellness policy, as well as transparency of the policy on publicly available sites. Requiring assessments every three years and updating the policy as necessary, making the policy available to the public, and districts are required to establish and identify wellness policy leadership as a point person in the district. Next slide. So the National Wellness Policy Study, as I mentioned, has been going on since the beginning of the original mandate with 2006 to 7 school year. For this particular study funded by USDA, we've been examining the implementation of the Healthy Hunger-Free Kids Act of 2010, which required that school wellness laws and related policies be implemented at the district and school level. We've been studying the impact of these laws on schools and students nationwide from both a qualitative and a quantitative perspective, in collaboration with most of the folks on today's call, including our hosts at Action for Healthy Kids, Dr. Lindsay Turner, Boise State University, I'm not sure if she's on the call today, Dr. Marlene Schwartz and her colleagues at the Yukon Red Center, and then of course our funder at the U.S. Department of Agriculture Food and Nutrition Service. Next slide, please. Before we dive into the qualitative work, which is really the focus of today's presentation, I just want to give you a preview of some forthcoming work we have that's quantitative, that's linking the relationship between state laws and district wellness policies with school, student, and district level outcomes and practices. The 4 bullets that we have on the slide just highlight for you a couple of examples of some of the findings that we have. So for example, we found that state laws that require wellness policies are associated with more comprehensive district wellness policies, and both state wellness policy requirements and district wellness policy requirements are associated with full levels of implementation of wellness policies at the district level. We also have found that state policies meeting Smart Snack standards, in addition to the federal law, are associated with lower student intake of calories from solid fats and added sugars, what's commonly known as SOFAS, as well as reduction in saturated fat intake. On the physical activity side, we found that state policies are associated with school requirements for physical education, as well as the amount of students who take physical education on a daily basis. And then in a district example, we found that having both district law and state policy are associated with implementation of nutrition standards for classroom and school celebrations, which are really in the purview of states and districts because they're not covered by the federal regulation. Next slide. Next slide. So on this slide, we just wanted to highlight for you a quote from the Consolidated Framework for Implementation Research, which is a theoretical framework for implementation research. We really wanted to highlight here the importance of connecting with local frontline stakeholders to understand implementation processes through the direct experiences and perspectives of these stakeholder informants. So as this quote indicates, people are not passive recipients. Rather, they seek innovations, experiment with them, evaluate them, find or fail to find meaning in them, develop positive or negative feelings about them, challenge them, worry about them, complain about them, work around them, gain experience with them, so on and so forth. I'm sure many of you can relate to this with regards to wellness policy implementation and school food policy implementation. And so the CFIR framework has really served as the framework for all of our work in this area. And that's why we felt like it was so important, not only from a theoretical perspective, but obviously from an academic research perspective and from the purposes of informing policy, to really hear from stakeholders directly and not just rely on quantitative analyses linking policy to practice. Next slide. Next slide. Thank you. So as I mentioned before, we spoke with a number of stakeholders that Yuka will share with you, but the broad topics that we spoke with them about related to their experiences and perceptions related to school wellness policies and food and beverage practices in general. We focused on lessons learned and best practices as well as challenges, awareness of the policy and related initiatives, their engagement with implementation, types of resources and technical assistance, fundraising, which we specifically spoke with superintendents and parents about. Evaluation reporting was items specific to superintendents, and then marketing on campus, we also spoke specifically with superintendents. So the first four bullets, are going to be cross-cutting bullets that we spoke with all of our stakeholders about. The last three bullets were primarily for superintendents, but we also spoke with parents about fundraising, given the important role that parents play in fundraising activities in schools. So at this point, I believe I am going to turn this over to my colleague, Dr. Yuka Asada, who will share with us the methods and go through most of our stakeholder finding results. Thank you.
Next slide, please. Good afternoon, everyone. I'll be briefly reviewing the methods with you so we can move on to the more interesting findings. If you're interested in more detailed methods, I invite you to look at the reports that Jamie mentioned that we'll be sharing with you at the end of the webinar, as each of the reports have an appendices at the end that have more detailed methods listed in them. So as you can see from the table, these are the stakeholder groups that we included in our series of qualitative studies. Food service directors, high school students, superintendents, and parents of middle school students. We specifically focused on parents of middle school students because there is less literature about middle school parents of middle school students compared to elementary or high school, and also it was an interest to the USDA. You can see starting in spring of 2015, we started to collect qualitative interviews and also moved on to focus groups with high school students and superintendents. As well, for each of those, we also had follow-up qualitative interviews with the participants who participated in the focus groups. And you can see our earlier work focused more specifically on school meal standards and smart snack standards implementation, and then we moved more broadly to look at local wellness school policy implementation. Next slide, please. We were fortunate to partner with many different organizations for our sampling and recruitment. The first with food service was a sample taken from my dissertation study. With high school students, we worked with the Funders Collaborative for Youth Organizing, which is an organization that works with youth of color and low-income youth, organizing around various social justice issues, one of which was school health and school food. For the superintendents, we were able to attend the school superintendents annual meeting where we conducted the focus groups with superintendents there. And lastly, with parents of middle school students, we worked with Action for Healthy Kids with their parent database as well as their Parents for Healthy Kids. The Parents for Healthy Kids database, which I believe will be introduced at the end of the call. You'll find out more about that as well. Next slide, please. For all of the instruments in the study, they were designed from our research questions. We had great input from school wellness experts and the literature. For most of them, we were able to pilot test the instruments with our stakeholders to correct for terminology and test for overall flow. And as Jamie outlined, we focused on perspectives and experiences across many different topic areas, but all related to implementation. And as is common in qualitative research, the instruments were revised during data collection. Next slide, please. Our focus group overall took about 60 minutes, and the interviews were between 30 to 60. They were all conducted by myself and a team of trained qualitative researchers. All data collection was audio recorded and transcribed, and participants received $50 gift cards for their participation. Next slide, please. And as you know, with qualitative analysis, we had developed a coding guide that was iteratively developed. We worked in version 8, TI version 8, which is a qualitative data analysis software. And with the high school students, in particular, we were able to conduct a member checking step where we were able to show them our early preliminary findings and receive feedback. And this was important because we had learned from the students that it was important that their voices were represented accurately, and also they were cautious working with university researchers, and so we wanted to make sure that we were accurately representing what they had told us. Lastly, preliminary themes were shared and critiqued by experts on several occasions by experts outside the analysis team. Next slide, please. And just to note a few limitations before we move on to findings. The interviews were all one-time data collection efforts. As you know, with implementation, it occurs over often over longitudinal time points, but due to resources, we were not able to collect data longitudinally. As you saw with our sampling strategies, the samples are not meant to be representative of larger stakeholder populations. We had unique opportunities to work with these stakeholders, and often many of them had gone through processes of implementation and were able to speak to them in an information-rich way. So they're very purposeful samples that we have included. And lastly, again, due to resources, we were not able to collect other data collection methods, such as going to schools themselves and measuring either through direct observation or more direct measurements to look at changes to wellness environments, which would have helped to triangulate some of the implementation activities. Next slide, please. So I will be sharing the overarching findings across all of the stakeholder groups next, but again, invite you to visit the website and our reports for more detailed findings from each stakeholder group. Next slide, please. So to start off, a very common theme that we heard across all of the stakeholders was that implementation takes time. Most participants described initial challenges, initial poor student acceptance that gradually improved as time went on. And as this high school student highlights, You know, at first, everybody's saying, what is this? Where's our normal food when things were changed? And by junior year, a lot of people liked it. So many different variations of this quote, but overall showing a lot of improvement now that it has been several years since implementation started. Next slide, please. We also heard many different examples of positive outcomes that stakeholders witnessed as a result of implementation. So everything from improved fruit and vegetable consumption with school meals, enhanced awareness about nutrition and wellness. We heard, you know, even just having discussions around why are we doing this, why should we do this, even through some of the pushback that they received, those discussions alone work to enhance awareness about wellness. Shifting culture and norms around wellness, and I'll share a quote about that next. Improved partnership between child nutrition and the district. And I'll mention this more in a little bit, but while many stakeholders did not directly measure changes to academic outcomes, many told us that they perceived there was the potential to improve academic outcomes as a result of improving wellness in the school environment. Next slide, please. Just some examples of some of the positive outcomes that we heard. So from this food service director, as she highlights, just seeing the high school students take all of the fruits and vegetables and eating them all was very rewarding for her to see. Also from the superintendent, noting the cultural shift of the organization was really key, even through little things like having water bottles with school logos, water fountains, teachers embracing the ball chairs. All these little steps led to accumulation in the culture of shifting toward wellness. Next slide, please. We heard about the Wellness Committee serving in different functions, but overall, as we have here, as a platform. So all of these things help to facilitate implementation. Food service directors who were part of a Wellness Committee reported more connection to district-wide implementation. Superintendents really talked about the committee more functionally as a place where they could ensure that the appropriate delegation of tasks is what was happening. And parents talked about wellness committees as a platform instead of them just being one sole parent voice raising concerns or trying to move steps forward. They used the committee as a platform to find strength in numbers, to find like-minded folks, and really help to move their concerns or their initiatives forward through the committee. Next slide, please. We asked about technical assistance and resources, and stakeholders described really the critical role that these partnerships with technical assistance agencies and organizations had played. In our superintendent report, we have a nice table that lists all the different types of organizations. These are just a few listed here, but we have all the organizations as well as the different types of programs and initiatives that they had formed with these groups. State child nutrition in particular was very commonly reported to be play a critical role in facilitating implementation, as well as many different types of not-for-profit organizations, local health departments, university and county extensions, local hospital and health foundations, as well as health insurance agencies were partnered with to focus on staff wellness and implement some more staff-focused initiatives as well. Next slide, please. And since we're on with Action for Healthy Kids today, I wanted to highlight really the role that Action for Healthy Kids and other nonprofits have played, as this parent highlights here, really just being able to link up to more resources and different locations where this work is happening. And really just having more people who share the same vision but have ways to help you promote it better. I think the parent stakeholder group in particular really talked about finding people who share the same vision, who have the same concerns, who are working on this together, and that being a key catalyst, again, not just being that one voice or that one parent trying to make things happen. Next slide, please. We wanted to highlight evaluation here as it's an important provision within the final rule for local wellness policies. We focused more on this with the superintendent stakeholder group, who are often put in charge of evaluation activities. And superintendents told us that they still face many challenges with evaluation, particularly with measurement in many cases. So, as I mentioned earlier, while they did feel that the wellness initiatives were helping or had the potential to improve academic outcomes, as this superintendent highlights, it's really challenging to determine whether or not it was the local wellness policy in an isolated way. So every time, as he says, we go back and look, yeah, but we made 18 other changes. So how do we know that it was the wellness policy that was responsible for that improved academic performance? Those were some of the challenges. However, most of the superintendents we talked to were very interested in best practices, in having more resources, in connecting to those who had done this work, and receiving technical assistance for evaluation. And in our report, we highlight some of the types of ideas that superintendents gave us for how we could make this easier for them. Next slide, please. And lastly, we wanted to highlight a common theme that we heard around school wellness and equity. Every stakeholder group talked about concerns that they had around the poor economy, how they were seeing that impact food insecurity as well as hunger. So comments that you see or quotations that you see in these examples, the economy is not as great as they want us to think it is. We're working multiple jobs. We don't have time to focus on things like wellness. This high school student saying that would be the only meal where some of their fellow students had. That would be some of the biggest meals that they have. And so comments like these and stakeholders highlighting that working to improve the school wellness environment were really perceived to compensate for the poor home nutrition and wellness environments that they were seeing, whether by boosting or impacting the nutritional intakes directly, whether it was, as I mentioned earlier, improving awareness around and nutrition education around, nutrition and wellness education. The ways that they were helping to improve the school environment were really helping to address what the students were not receiving at home. Next slide, please. And lastly, with our superintendents, we continued this inquiry into ways that superintendents had described initiatives to address hunger. So they talked about backpack programs, implementing universal school breakfast, and initiatives such as school food pantries, where they have pop-up pantries that come to the school. This was a partnership with a local food pantry that would come every 2 weeks and once a month during the summer. So superintendents described many creative ways that they were addressing hunger concurrently with working on their wellness policy. So I believe next Marlene will be discussing food marketing and fundraising in schools.
Yes, thank you. Can you all hear me? Everybody else can hear you. Okay. Thanks. So I'm delighted to join you all for this. So the next section, we're going to talk about two related topics that we explored with both the superintendent and the parent stakeholders, which are food and beverage marketing and fundraising. And those are areas, it turns out, that really overlap quite a bit. Next slide. So food marketing shows up in schools in a number of different ways. Some of them are sort of obvious, those big logos that you might see on school equipment, like scoreboards. Sometimes commercials are shown during in-school educational programming. Also fundraising. frequently uses branded products. And people might not think of that as marketing, but it's definitely getting particularly food brands into a school. In addition, companies sometimes have coupons that they will use as rewards in the classroom, and some companies have created actual educational materials that sort of build in their brand. And I'll show you some examples of these. Next slide. So as you can see here on the upper left-hand side, this is McTeacher's Night, which some of you may be familiar with. And this is an example of restaurant fundraisers. So these are fundraisers where teachers would encourage students and their families to visit, in this case, a McDonald's on a particular evening. And sometimes the teachers are actually working uncompensated behind the counter in McDonald's t-shirts, and then a portion of the night's sales are donated to the school. On the top right, you see Book It, which is an example of one of these sort of incentive programs that is branded. So this one is about reading, and so the idea is to set a reading goal for children in the class, and then when they meet their monthly goal, the teachers are encouraged to recognize them with a reading award certificate, which is good for a free one-topping personal pan pizza. The website for this particular program points out that it was created in 1984. It currently reaches more than 14 million students in 37,000 K-6 schools annually. On the bottom row, you can see these are two examples of counting books. And so clearly these are designed to help children learn how to count, but they're using things like Goldfish branded and branded Oreos to do that. Next slide. So we conducted these superintendent focus groups in March of 2017. So the final rule had not yet been broadly communicated. So we found that most superintendents were really not aware of the local wellness policy food and beverage marketing provision. However, they did express concerns about, insidious was a term that got used, nature of marketing. They also agreed that marketing really gave food and beverage companies a foothold on students as consumers. And so, as you can see with the quotes, they realize this is how companies are getting into schools. They realize it's for profit. They really don't have the students' best interests or well-being in mind. Next slide. However, despite the concerns, the participants described quite a wide range of practices in their different school districts. So some had banned marketing of any kind at all. Others allowed only healthy food marketing, and others didn't impose any restrictions at all. So we also heard a lot about the challenges of changing marketing practices. So this is a quote from one of the superintendents where they don't allow any marketing, and for them it was easier to have this zero tolerance policy, because that way if they let one group in, they didn't have to turn around and then let other groups in that they might not agree with. Next slide. Another concept that we heard, though, was this a means to an end idea. So they didn't have strict restrictions on marketing, and they really saw it as sort of a complicated trade-off, that it allowed the school to get resources that ultimately supported academic goals. For example, reading, which of course is very important. And they felt like it was worth the sort of price of the marketing something like pizza in order to encourage kids to read in this case. Next slide. Restaurant fundraisers were talked about a lot. These were the most common source of fundraising, and they were often connected with PTA or PTO groups. And it was pointed out that those groups didn't have to adhere to the same fundraising policies that groups that were operating within the school, sort of as part of the district or in the school building, might need to comply with. So the superintendents talked about the challenges of knowing that often the restaurants were not supporting healthy eating, but they also didn't want to rock the boat with parents. One superintendent described it as sort of bittersweet. Next slide. They saw fundraisers, though, as implicit marketing. So they realized that if they were allowing this type of marketing to take place by their PTO, that they realized that they were endorsing it. And you can see from this quote sort of the struggle of this superintendent feeling that, you know, they were endorsing it and sort of acknowledging, yes, 20% of all sales are going to the school. Yay, what is that on a meal? Someone tell me, is that 12 cents? So they kind of were struggling with how much was the school really getting out of their sort of allowing these brands to reach their students directly. Next slide. At the same time, this is a quote that really focused on the positive perspective on fundraising. And so this was, this idea that families are coming together over a meal, they're seeing each other outside of the school day. It's a fun, relaxing atmosphere to build relationships. So I think that was another part that really complicated it, is that the actual events could be fun and, you know, kids and families might really enjoy them. And so there was a lot of ambivalence about how to handle these events in the community. Next slide. And I'll pass it over now to Jamie.
Thanks very much, Marlene. Next slide, please. Thanks. So as Yuka and Marlene indicated, we had a number of interesting findings, many of which may not be very surprising to you, but if anything, they might be confirmatory given the experiences you may be having. So much like most policy implementation, many stakeholders experience challenges initially, but implementation and student acceptance improve with time. And Yuka shared that interesting quote where in the beginnings with the school food changes, students were very weary when they came in their first year, but by junior year, they were looking forward to the food that was there. So just stay the course, be patient. Implementation of these things may take a little time for uptake, but usually it leads to positive outcomes in the end. And that leads to the next one about they experienced a wide range of positive outcomes. We weren't able to share all the outcomes on this, and many of our quantitative studies that are forthcoming will share additional information on how these policies are being implemented in practice and linkages with student and school level outcomes. Evaluation remains a challenge for superintendents and for schools, and superintendents are really in search of technical assistance, training, and other resources to help them with implementing not just wellness policies broadly, but the new guidelines in the updated federal rule related to wellness policy. At this point, there's a lot of guidance out there on school food and school meal implementation and smart snacks, but some of these other provisions, they really could use some help, particularly when it comes to evaluation reporting. In the next bullet, we talk about the importance of the intersection between school wellness initiatives and issues of student and school-related equity issues. And this is an area actually that Dr. Asada is continuing to pursue, particularly related to rural school food issues, and stay tuned for more information on that forthcoming as well. And then Dr. Schwartz spoke about food marketing and fundraising and how they vary widely. And although there are negative perceptions of marketing in schools, there are a number of practices that schools and districts are doing to address school food marketing and fundraising policies to be in compliance with the new rule and to try and continue to improve the overall school food environment. Next slide. So some short recommendations here. This is not the end all and be all, of course, and we want to allow time for your questions. We're really looking forward to them. So please include them in the chat box if you have any questions for us. There are many opportunities to provide directed technical assistance and resources for evaluation of wellness policies. If you're an evaluator, it's a great opportunity to work with your school district and schools to work on, developing mechanisms for evaluating the policy so that it can be included in the required triennial report that districts are required to comply with. If you're at the federal or the state level, or even an advocacy organization such as Action for Healthy Kids, developing technical assistance materials to help districts and schools would be greatly appreciated. Stakeholders felt that the technical assistance and resources ideally should be targeted to school administrators as well as to districts, including school boards and superintendents. And then for those of you who are researchers on the call, and I know there were about 7% of you on the call, we need more research on ways that schools are addressing hunger and food insecurity in conjunction with school wellness. Those topics are not issues that are required to be addressed in school wellness policies, although we're increasingly seeing these topics addressed in school wellness policies or related policies that school districts are adopting. Next slide. Additional recommendations are opportunities for improving awareness about food marketing and the other food final rule provisions that we mentioned. But improving awareness about food marketing beyond just food service directors and child nutrition staff, including superintendents. It was interesting to us that many superintendents were not necessarily aware of the food marketing provisions in the final rule. So that's an area for dialogue. And then also, I'm a parent of a high schooler, and it's pretty clear to me they practice some of the things that Marlene was sharing with us in my son's high school. So there's continued opportunities for translation and improving awareness at the school building level, not just between parents and PTOs, but also with school stakeholders, building stakeholders, including principals and teachers and club leaders and things like that. And then opportunities to collaborate or align efforts between parents groups and wellness committees. Sometimes they're fully aligned. The parent-teacher organization may actually have the wellness committee as a subcommittee of their group. Other times, the wellness committee is its own separate freestanding group, and there's very little linkage between parents and the wellness committee, except for maybe having one parent on the school wellness committee or district wellness committee. So creating more opportunities and leveraging opportunities for linkage would be critical in helping with implementation efforts across the board, in addition to providing better opportunities for promoting healthy fundraising and marketing efforts. Next slide. So Yuka and I mentioned a couple of the resources that you could look for. On the bottom of the screen there is a short URL, www.go.uic.edu/NW, P as in Paul, S, lowercase products, and that'll take you to all the products we've posted thus far. We have a number of additional products forthcoming related to superintendents, related to parents. We also do a quarterly fundraiser state law report. We'll be posting abstracts to our published papers on these sites as well. If you're interested in any of the published papers and you may not have access to them, please don't hesitate to reach out to us. We'd be happy to share them with you. The briefs, I'd like to note, are designed intentionally as peer-to-peer briefs. So for example, the first one on the left, the food service one, we have a brief specifically targeted at food service directors. For the student one, it's presenting it from a student stakeholder perspective, and it's really helping districts and schools better understand the student perspective. We have a parent one that will be targeted at parent groups, and then the superintendent one targeted at superintendents as well. And we have several briefs for each stakeholder group. And we also have full reports if you're interested in delving into that. The researchers on the call may be interested in those. Next slide. So if you have any questions about the study, please don't hesitate to contact any one of us. We would welcome your questions both now and later. If you have any questions now, please go ahead and enter them in the chat room. We would love to entertain them. And I think I am now turning it over to Jillian to tell you a little bit about the Parents for Healthy Kids newsletter and database.
Great, thanks, Jamie. Just wanted to do a quick little plug for the Action for Healthy Kids parent newsletter. So if you're looking for more ways as a parent to get involved in school health or even health at home, you can sign up for the Parents for Healthy Kids newsletter. You'll get monthly updates with school health news, recipes, and helpful tips. So you'll want to go to www.parentsforhealthykids.org/community sign up. I want to thank Jamie, Yuka, and Marlene for this informative presentation. No questions in the queue?
To Jamie.
Yep.
All right. Great. So is there a question on the queue there for you, Jamie?
I don't see the question, so if you all, oh wait, hold on, I see. I can't really see them, so can you possibly read them? That would be great.
Okay, I'll do that. All right, so we have a couple. Someone was curious to know if Mississippi is included in the study.
So I'm going to let Yuka answer. We have stakeholders from across the country. In our quantitative study, quantitative studies includes stakeholders and students in schools and districts from across the country. Yuka, I don't know if any of the stakeholders studies included Mississippi.
Off of the top of my head, so each stakeholder study, we didn't select by state first. We selected, as I mentioned, with each of the different organizing groups. So, for example, with the superintendents, it was all the superintendents who had attended the meeting. I believe there may have been one or two who attended from Mississippi, but I don't have it off the top of my head.
Okay.
And then, oh no, I see it. So Yuka, what is the further research that you're doing? They were asking a question for us about further research on food insecurity in schools. Yuka's actually doing more research related to rural school food environments. Marlene, I don't know if you want to talk about work that you're doing related to food insecurity. That's an area that I know we're collectively interested in, but we haven't really delved into that issue as much yet on our end.
Yeah, I'm definitely interested in food insecurity. Most of the work that we're doing right now is focused more at the food bank and food pantry level, but as people on the call may know, sometimes those food pantries are in school buildings. So we don't have a specific study going on right now on food pantries, but that is something that we're certainly interested in pursuing.
And Yuka, do you want to share briefly what you're doing related to rural school foods?
Sure. So we're just concluding a study looking at rural school professionals and implementation of school meals and smart snack standards. Very similar to the overarching questions that were asked here with the National Wellness Policy Study, but looking more specifically at what is unique to rural schools, what are some of the unique challenges that they face as a result of their geographic distances and other characteristics, and then what are some strategies that we can use to address those challenges. So those products will be forthcoming as well.
Somebody did post a question asking about the URL, and they were having trouble with it. And so I am posting a new URL, or I'm going to try to, in the chat box and see if you can get that to work. It is working for me. Any other questions? I don't see any more coming in at the moment. Oh, do you have any recommendations for how to attract parents to wellness committees based on what you heard from parents and committee members? Yuka.
We did hear, we did have parents provide us with recommendations, and that will be listed in the parent report. Some examples of recommendations that we heard were making the meetings at times that are accessible to parents, particularly working parents who may not be able to attend, say, an 11 a.m. during the weekday, so being mindful of times. Providing, in some schools, we had examples where they provided childcare or other assistance for parents who, just to address some of the barriers for how parents were not able to come. So things like childcare, one school district even provided transportation for parents to be able to come to the meetings. But even if the district isn't able to go to that extent, some parents just wanted to be included in offering what are some barriers and what we could do to help. Other examples were things like making wellness more accessible to parents. Some parents felt that often people used acronyms or assumed that parents knew what wellness in schools was about. So providing just more discussions and inviting parents in a way that doesn't exclude them through language. That was another recommendation.
Great. Thanks, Yuka. So we have a bunch more questions, so I want to try and get through as many as we can. So do we have any data from middle or elementary school students? So the stakeholder group of students was actually high school students, but in our quantitative analyses that we'll be presenting, it will include students from all grade levels, so stay tuned for that. The next question, Marlene, it didn't surprise me that superintendents didn't know about the marketing standards, but in your work, did you ask why they weren't aware?
I think that part of that was the timing of when we conducted the focus groups, because it was back in spring of 2017. But I think that would be a great question to ask now, because I would think by now they might be more likely to have heard of it. So do you have any other thoughts just from having done those groups?
No, we didn't in fact ask why they didn't know at the time.
But I think Marlene's right in terms of what our timing. So somebody was asking for any guidelines on how crafting the policy to include results and measurable and attainable goals. I know that certain groups, Jillian, I'm not sure if Action for Healthy Kids has maintained any of the model policies that you used to develop, but do you have any guidelines out there on evaluation, results, and measurable goals for inclusion and wellness policies?
Not that I'm aware of.
Okay, so Center for Science and the Public Interest may have some, as well as the Healthy Schools campaign. And if we can come across a few others, we will certainly share them. Actually, Aaron Hager at University of Maryland may have some material there as well. How can school nurses help with the school wellness policy implementation and food insecurity? Great question. Yuka, do you want to field that one?
Sure. I think, was it specific to food insecurity?
It was specific just with school nurses helping with school wellness policy implementation and food insecurity.
Okay. I think, well, with school wellness policy implementation, I think it's very important that the school nurses are part of the school wellness committee. And helping to advance implementation activities there. We're not quite sure yet in terms of food insecurity who are the key implementers moving those forward in terms of some of the pantry programs. What we heard from superintendents was it was either themselves or another stakeholder, but we're not 100% clear on who those implementers were. I think school nurses would be a great advocate to help facilitate some of those programs.
Can I just jump in too with an idea?
Please.
Just from having heard people talk about this, I think school nurses are incredibly important, because a lot of times when kids are hungry, they'll go to the nurse because their stomach hurts, and then the nurse might have food to give the child and realize that the child's hungry. So I wonder if maybe one strategy would be for school nurses to really keep track of how frequently that is happening, and then reporting that information back to the wellness committee, sort of in a more systematic, routine way. Because certainly when I've heard about food insecurity in schools, that's one of the sort of stories that I've heard several times.
Great. Well, thank you, Marlene. I think that covers all the questions, although I think we did have a comment from one participant who said that when I started working, the food service directors knew before the final rule came out. I think it was probably about the fundraising and marketing provisions is my guess. And so, yeah, that's generally been our experience. Food service, child nutrition staff are well informed on things, and superintendents less so. And so that was one of the themes or messages that we had in general, was that needing to expand the dialogue so that it goes up the chain, as well as in the district, specifically within food and nutrition and child nutrition. So Jillian, I'm going to turn it back over to you to close out. We want to thank everyone very much for participating today. If you have any questions for us, please don't hesitate to contact us. The slides have all of our email addresses in them. The handout in the webinar pane has our slides included. So thanks, Jillian.
Thanks, Jamie. Well, that concludes our webinar for today. I want to thank everyone for being patient with us at the beginning of the webinar. I apologize for some technical difficulties. We'll be sending out a follow-up email in 2 to 3 business days with a link to the recording. Thanks, everybody. Thanks for your time, and have a great day.